So, just a quick note about this episode. Dr. Emma-Leigh Senyard is a clinical psychologist, and she mentions the term ASD as this is referenced by medical professionals in the course of their work. I know some people don't prefer this term ASD, but I've discussed this with Emma, but overall, this is a really good interview about autism and how the nervous system is impacted. So, let's get into it.
Looking for authentic conversations that go beneath the surface? Tune in now to the Deep Dive podcast. Visit us at www.deepdiveau.net. That's deepdiveau.net. And follow us across your favorite platforms: YouTube, Instagram, LinkedIn, TikTok, and Facebook. Just search at the Deep Dive AU. Join us as we dive deep into stories of neurodivergence, lived experience, and creating a more inclusive world. The Deep Dive podcast. Conversations that matter. Stories that connect.
This is the Deep Dive podcast. And here is your host, Michael Coles.
Emma-Leigh Senyard is a clinical psychologist with a PhD with over a decade's experience in private practice, community health and GP clinics, university settings, and occupational rehabilitation. Emma-Leigh has extensive experience working across the lifespan with young children through to older age populations. Most of her career has been spent with children, adolescents, and parents in the areas of autism spectrum disorder, attention deficit hyperactivity disorder, cognitive learning assessments, anxiety, and behaviour management. In the past several years, Emma-Leigh has shifted to working predominantly with adults and adolescents 14 plus in the areas of nervous system regulation, generational trauma, general psychological well-being, and mental health prevention. Emma-Leigh Senyard, welcome to the Deep Dive.
Thank you for having me, Michael.
So, how does autism affect the nervous system differently compared to neurotypical regulation?
Yeah, it's a great question. So, when I'm talking about the nervous system, we all, of course, have our own nervous systems, which started, millions of years ago when we were cavemen, way back then, right? But the threats back then were very different to what the threats are now, right? So back then, we used to have to protect ourselves from predators and hunt and gather and food and so on. But in today's world, we've evolved still having this fight or flight response in our body, but often to threats that are not real, perhaps, or threats that aren't going to risk the livelihood of our life, for example. But it gets complicated if you're experiencing or you have ASD, because some of the challenges that a neurotypical person may have, some of the challenges that you may have, a neurotypical person may not have. So that might be sensory challenges, that might be understanding social influences and social cues and so on. And then also regulating your emotions as well. So when you've got all this extra, you've got like normal life stress, like, finances and children, which can be a stress, but also a love, work, and just everything else, putting food on the table, everything else. And then you have ASD on top of that, and then you're adding sensory sensitivities as well, understanding social cues and so on. That can really overwhelm the nervous system really quickly. And that can then create sometimes a more likelihood that maybe if we can't regulate our nervous systems and we can't regulate our emotions, we can, the volcano can explode perhaps. So that's what I'm really talking about, and when I'm talking about the nervous system and why it can be more challenging when you have ASD.
Okay, so what does nervous system dysregulation actually look like for day-to-day for autistic people?
Sure. Well, it's going to look different from person to person. But what I can say is when I'm talking about the sensory sensitivities and so on, that can be particularly heightened when your nervous system is a bit more dysregulated. So, and you'll be aware of that as well. Everyone senses, so even a neurotypical person has sensory sensitivities, but they're just, if you were to say, perhaps on steroids sometimes when you're experiencing ASD, and it can make it really challenging to function in your day-to-day life when you're experiencing those. So you might have them day to day, but something that might be a sensory concern one day that you can kind of manage, but it's a little bit annoying or it irritates you or might create a little bit of anxiety. Another day when your nervous system is really dysregulated might actually mean that you can't leave the house for the same sensory sensitivity, for example. Or if you're in the same environment, perhaps in a workplace, and you repeatedly are struggling, perhaps to understand social cues or influences or jokes or sarcasm or whatever that may be in a workplace, and you're repeatedly doing that, over time that can build up and build up and build up. And then all of a sudden you're having panic attacks, you're struggling to leave the house, you get Mondayitis, as I say, dread going to work, you call in sick, and so on. Or you can't even leave the house for some people. Some people can't even work, perhaps, or engage in a meaningful conversation like we are. It can also look like physical sensations in the body. So that could be headaches, it could be back pain, pain in general that I see a lot. And we don't often attribute what we see in the body to being nervous system related, but it is very much so. We can store a lot of stress in our body that can lead to the migraines and headaches and so on, but it can also lead to muscle tension as well. And that's that kind of fight or flight activation or that nervous system activation. It can be also an increase or a decrease in appetite. It can be worsening signs of depression or, in severe circumstances, suicidal thoughts, lots of panic attacks, irritability. Maybe you're getting more frustrated with your children. And a lot of these things that I'm saying actually happen with neurotypical people as well. I want to highlight, like for me, sometimes, I'm not always super calm with my 4-year-old. That's very, very normal. But when you have that ASD, it's just that maybe some of those triggers might be the same, but then there's going to be some additional ones that might be more challenging for you compared to someone who's neurotypical.
Okay, so many autistic people live in a chronic fight or flight freeze state. What drives this long-term activation?
Yeah, great question. So it can be a combination of things. Um, Often there's a few things here. So it can be, which we'll touch on soon, but it can be actually modeled from family members and from your parents. Often, but not always, we see ASD sometimes be within families or generational within families. And if one person, or even if it's again a neurotypical person that can't regulate their emotions as well or struggles to regulate their emotions, which is a lot of people, that can then be modeled down generation after generation. And then that can create a sense of stress within the body. Even if we're not aware of it, it can create that muscle tension or that feeling like I'm not safe. Even if we're not consciously thinking of it, our body can respond in a way that says, I'm not safe in this environment. And that, for example, with the sensory sensitivities, some things you may have a sensitivity to, like going to Coles, for example, on Black Friday, or going to Coles in general. That could be really overwhelming in terms of, from a sensory perspective. And what your body's really saying there is, I don't feel safe here. I'm not safe in this environment. There's too much going on. There's too much input. There's too many people. There's too many noises. There's too many lights. There's too many colors. And that's like a really overwhelming, overwhelming to your sympathetic nervous system. And you're constantly in that fight or flight state. So what's driving that long-term activation, along with like modeling from your parents, like generational trauma, and your own sensitivities or challenges within ASD, and also social challenges within social stuff as well, is challenges with your ability to regulate those emotions or having the skills that you need to manage in those situations. Maybe you haven't quite found what works for you in those situations. And I'm going to say that sometimes avoidance is the answer, but a lot of the time it's not, because you've got to function in today's society. And I've seen many clients before where, to help them manage and cope with their ASD, it means not leaving the house. It means not having a job. But that is not a way to function in society, and it may create excessive anxiety as well. So without having the proper tools and strategies in place that work for you, that's what's going to keep driving it.
Okay, so how do the sensory processing differences impact the nervous system's baseline level of stress?
Yeah, so I think we've probably touched on that a little bit. And I like to draw, and I might draw this and pop it on my website as a free resource afterwards, but I draw what's called a stress threshold or stress curve. And basically, everyone has stresses, right? As I was talking about earlier, work stresses, financial stresses, children, so on, family, etc., right? And then you add those other stresses of ASD, sensory challenges and social situations and whatever, so many challenges. It's different for everyone. They can build up and up and up and up. And then we can reach a stage where the lid can just flip or the volcano can overflow. And then once you pass that stage, there's little we can do when we've exploded to really manage in that moment. Sometimes sensory strategies do work up there, but they're some of the few strategies that do work in that moment. What we really want to do is prevention of that as much as possible. So, as you say, bringing our baseline of stress to to a level that we can cope with it, or increasing our nervous system's capacity to cope with everyday stresses and managing that, or maybe changing environmental situations, like if a workplace isn't aligned with you and your values, maybe you would potentially change that workplace or change the people that you're around and so on that are, potentially causing that. So sensory challenges, of course, are going to naturally, unless there's good strategies in place, raise that baseline level of stress and raise that nervous system dysregulation.
Okay, so what are the early signs that an autistic person's nervous system is becoming overwhelmed before meltdown or shutdown?
Again, going to look different for everyone. But going back to that kind of natural curve that I was just talking about, the stress threshold I was talking about, what I like to do with people and clients is get them to start to have awareness of what that looks like for you. So when you are just near the top of that volcano, just right at the peak before you can see the lava inside, what does that look like for you? And recognizing that that is a sign, hey, I've got to stop here. I've got to redirect. I've got to change. I've got to have a break. What does that look like? And that might be, maybe I'm a bit more snappy at the kids. Maybe I've feeling hot and bothered in my body. Maybe I've got a headache. Maybe I've got muscle tension. Maybe I'm feeling on the edge of having a panic. I'm not having a panic attack, but maybe I'm on the edge or about to have a panic attack. What I find with ASD is that people often describe they go from 0 to 100 or 0 to 10 very, very quickly, and they can't recognize what some of those small triggers are. But if you can start to diarize that, journaling is a very effective strategy, or writing down when you do flip the lid or when you do become dysregulated, after the fact, actually writing down what happened in that moment, what happened just before it, and how did you then come out of it. Awareness is really key. It's really important to help us, for you, recognize, okay, what are some of those things?
Okay, so can repeated masking contribute to nervous system burnout or trauma over time?
Oh, yeah. 100%. It's absolutely exhausting. It's really difficult. As much as I say to people, we want to be ourselves, what is really challenging with ASD is that in today's society and workplaces, and we've had this conversation before, but in workplaces or different social situations, is that it's trying to put a square into a square peg into a round hole. That things that are challenging for atypical neurodivergent people are not necessarily for neurotypical people. So when you are doing your job, dealing with all the other stresses that everyone else deals with, and then also masking to try and fit in with people at work or to try and understand the influences that people are talking about, that is very exhausting, and it's going to contribute to that burnout and nervous system dysregulation to the point where it can be that there's a major breakdown in the system, in the body, in the nervous system, where you actually just can't get out of bed. You don't know why, but you actually can't step foot outside the door. You can't possibly go to work. You can't possibly make that phone call. It becomes too much and overwhelms the nervous system.
How does the concept of generational trauma or learned stress patterns show up in neurodivergent families?
What is really tricky is that the way that we parent or the way that we are as an adult has often been modeled to us growing up. And we often don't know any different to how we were taught by our parents on how to act with other people, how to be with other people, how we dress, how to go to work, and so on, unless we've been exposed to that. And unless we have maybe done, I don't want to, I mean, there's some controversy about using the term social skills. It's almost like assimilated with the general population, which I don't really believe that. I think that people should be themselves as well. But unless we've been given some of that education, it just tends to follow from generation to generation to generation. And when you have awareness that this may be happening, for example, perfectionism might be a trait within the family, feeling like you've got to please other people, feeling like you never put yourself first, that you're not good enough, that you can never make other people happy, that in terms of parenting, that the way that maybe the parents in your generation have done it is by not talking about feelings, excluding you or making you miss out on things, not being told that you're loved, smacking and physical discipline, then unless you have awareness of what some of these things are, then they often just will carry on. But when there is awareness, you have that opportunity to break that cycle.
Okay.
And that can be really empowering, knowing that you've got a choice.
Okay. So, what evidence-based approaches can help regulate the autistic nervous system in everyday life?
Yeah, yep. So there are so many evidence-based tools, and it's just about working out what is for you and what's going to work best for you. So, for example, breath work is really powerful and meaningful, but I have had some clients with ASD who really struggle with breath work. The reason why breath work is really effective and helpful is because when we take really deep breaths, so in through our nose and then out through our mouth, and there are lots of different ones that you can do. For example, box breathing, which is 4 breaths in through our nose, holding for 4, and then out through our mouth for 4, and then holding again for 4. The reason why that can be very effective is because it actually activates the vagus nerve. The vagus nerve is partially responsible for managing your sympathetic nervous system, which is all about your fight or flight or the nervous system. But again, for some people with ASD, they find deep breathing or abdominal breathing very challenging and very tricky. So it may be box breathing, it may be meditation and doing guided meditations. Again, that could also be very triggering for some people. It might be being in nature, being outside, getting sunshine. It might be doing muscle relaxation. It might be having a cool shower. Sometimes holding some ice can be really helpful to just change the body's sensory input, especially if you're in a heat of the moment situation. Another thing that I think that is less kind of in the moment, but more of a long-term strategy are things to consider, like boundaries in the workplace. For example, only working your set hours, not working additional hours that you're not paid to do that you're expected to do for free, because that's not attainable. That's going to lead to burnout quickly. And maybe there needs to be conversations had if that's an issue. Boundaries with people, potentially, that may be overwhelming. Boundaries with potentially environments or situations that might be overwhelming from a sensory level as well.
Okay. So, how can autistic adults begin to reset or retrain a chronically overactivated nervous system?
Yeah. So this sounds very simple, but my favorite, when you're in a system that's chronically overactivated, I don't want you to add more and more and more strategies, more things. What we want to do is slow. And now it sounds very simple. It is, but that's what your nervous system likes, because our mind is so busy running all the time and going constantly. I've got to do this, got to do that, or stressing about, oh, why can't I just do that? Why can't I just be that person? Why can't I just leave the house? Why am I not good enough? Blah, 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 all of these things. And the nervous system likes it when we are slow. So that's slow in everything we do. Intentionally walking slower, intentionally talking slower, intentionally eating slower. Mindful eating is an evidence-based strategy where we actually ask people to really slow down and pay attention to what they're eating, how they're chewing, what the tastes are in their mouth. Are they chewing really quickly, aggressively? Can we slow that down? just really, it's almost like going in slow-mo, like the Matrix. But really, really slowing down is, I would say, the first step, and then becoming aware before we then start to overload some of those other strategies I was talking about, like the breathing and so on. And then also thinking about boundaries and thinking about whether the things and the situations in your life are values driven. So the things that you're doing, for example, I could use this podcast that you're doing, Michael. Is this something that aligns with your values? Is this something that is important to you that you're getting meaning from doing? If you're doing a job or you're doing something and it's not deriving any meaning, then maybe it's time to consider, is this for me?
Okay, so there's growing talk about biohacking mental health. What nervous system supports actually have good evidence behind these?
Yes, I love this topic. And when I talk about biohacking for your mental health, I'm talking about prevention of anxiety, depression, panic attacks, overload, dysregulation. And just the same way you would eat well, go to the gym for your health, for your physical health, go to the doctor for your physical health for a checkup. Biohacking for your mental health for me is prevention. I always speak to clients about having non-negotiable things you do every day for your mental health. And that is even if you're not anxious, depressed, or struggling in some, I guess, consciousness, that level of, I guess, peace or functioning day to day. So it can be things like music. Music has been found to be greatly associated with positive mental health. I just want to, with the preface there, that if you are experiencing depression or anxiety and so on, actually listening to negative music that's going to feed in or validate those same thoughts, the depressive music is not helpful. The evidence for that is there is no, like it's not helpful to do that. So you want to listen to uplifting or emotionally positive music. It's also been shown to reduce Alzheimer's risk as well, listening to music. Also, being outside, being in nature, is a huge one as well. The sun gives us, of course, vitamin D, but it also gives us endorphins or feel-good chemicals, especially if we're seeing sunsets and sun rises. Both of them can boost our own mental health as well. Exercise is a huge one for releasing dopamines. Even just doesn't have to be high intensity, just going for a walk. All of those things are just really simple tools. Also being outside, when you're outside getting your sunset and your sunrise, which I try to do most days. Grounding barefoot on the grass can also be hugely helpful too. When you're grounding barefoot on the grass, you're getting negative ions from the earth, which actually reduces inflammation in your body, and that's helping with your mental health as well. And meditation as well. There are lots of different things that you can do for prevention.
What happens when both parent and child have sensitive or dysregulated nervous systems?
Yes, I'm sure a few of your listeners are aware of what happens, but it can, in the moment, it can create, of course, a recipe for disaster. So I have seen, I probably don't need to repeat some of the things that, your clients have seen, but I have seen quite extreme circumstances where there has been physical aggression and violence. There has been, holes in walls. There has been hurt people, hurt siblings, and threats, and to the level where there has, of course, been involvement by other services and things, because it becomes a risk of safety. At a longer term level, unfortunately, continued dysregulation happening both ways, where continued butting heads constantly without resolution, is that it can damage attachment relationships between parents and children. And I say that again with the caveat around without resolution, because of course we can all become dysregulated. We can all get frustrated and angry at our children from time to time. I'm not perfect. But in those moments, it's really important to be aware that we have the opportunity to use that as a learning experience for children as well. So it wasn't that long ago that I said to my 4-year-old, I'm sorry that I got angry earlier. And what you're doing there is modeling that it's okay to, one, make mistakes, and that apologizing is a good thing. Perfectionism is very common within ASD. We see a lot of people that are perfectionists that have ASD, but it's not realistic to continue to have high levels of perfectionism because it impacts your life, your productivity, your stress and anxiety levels, and so on. So yeah, there is an opportunity, perhaps, I guess, as the parent, when we're talking about that generational trauma, to really break that cycle, learn to regulate yourself so that that can then be passed on to your children.
Okay, so how can autistic parents support their child's regulation without pushing themselves into burnout?
Yeah, good question. So I think the answer really is it starts with you. It starts with yourself. So with modeling, and regulation of yourself, you are then modeling that to your child on how to regulate. With children, it's really important to be aware that it's unrealistic to expect a child, ASD or not, to be able to regulate themselves. Children learn from birth, they start to learn to regulate their emotions with co-regulation. So that's soothing a crying baby, rocking them to sleep. And as children get older, sometimes people with ASD don't like physical touch. Some do, some don't. So regulation can look like holding a crying 7 or 8, 10, 13-year-old child, or it can look like just being present and just being next to them, just sitting on their bed next to them saying, I'm here for you. Even if you don't want to talk about it, I'm here for you. So co-regulation is important, but as an adult, if you can regulate, that is going to work wonders for your child as well. You start to model that behavior. As an adult, sometimes we also need co-regulation too. We need support of a healthy, we call it healthy adult in schema therapy, but what I'm really referring to is someone that you feel safe with, who is regulated in that moment or can regulate their emotions to help kind of bring you back down, to help you regulate in that moment. So awareness is really important, working on yourself, perhaps even having to reparent yourself. Reparenting, I'm referring to, is the way that maybe you were parented growing up, maybe that wasn't effective, or you have some trauma in regards to that. And maybe there needs to be a level of reparenting and giving the little you, the inner part of you, the inner child, some support to reparent you. So there's a lot of work with that. And really, I'd recommend doing that with someone, with a licensed therapist.
Okay, so what are the practical ways families can create a low threat, regulation friendly home environment?
Yeah. So this is going to depend on family to family and what works for some children and what works for some parents in terms of how they regulate their emotions. What I've done with families in the past is things like family rules and or family regulation strategies. And we've all worked together on a big poster. We've written them all down and we've popped that up somewhere around the house. And these are simple strategies that everyone is aware of that works for your family when you need it in the moment, or if you just want to create that safe environment. And so that might look like having a safe space, a timeout zone, or just a safe chill out zone. And we all need that. I need that sometimes. And so that might be an area under the tree, on the trampoline, for some kids laying on the trampoline. It could be a teepee in someone's room, or your own bedroom as an adult, or something like that. It might be reducing the amount of sensory stimulation as well to create a safe environment, not having the background. Neurotypical parents don't often understand when they have children with ASD. They're kind of unaware of, and that is no fault of their own. They're just not aware of what it's like to have ASD with all of these sensory challenges, but often have like the TV on in the background when no one's watching it. And then, then there's the radio on in another room, and then there's lights on, and then the fridge is beeping because it's been left open, and there's too many things going on. So if we reduce those inputs, it can make it much easier for children to be able to regulate, for adults to be able to regulate as well.
Okay, so how can parents recognize the difference between behavioral issues and nervous system distress in their child?
Yes. Yeah, this is a really great question. It's what parents often don't understand or recognize, which again, to no fault of their own, because no one teaches us this when we go to school, is that often defiance or non-compliance in children, or anger outbursts, is actually underlying anxiety. So if you have, for example, a child who's got school refusal, refusing to go to school, and you're seeing kicking and screaming and violence, that's not necessarily them being defiant or behavioral problems as what it's commonly labeled as. It may be that there is anxiety about going to school because of social situations, because of bullying, because they're struggling to make friends, because of academic concerns. They don't understand a task, or it's too easy. Very, very commonly with an ASD, it's this is simple. I'm bored. I'm more stimulated at home. So often, I would say most of the time, it's actually not purely behavioral. There's something underneath it. So I think, again, awareness. What I find really helpful to do this is by doing a behavior monitoring form or behavior monitoring sheet. And again, I can put one of these for free. By the time you air this episode, I'll have it on my website for free under the free resources. That can be really effective to do these. And I recommend doing these over 1 to 2 weeks, where you are a behavior monitoring sheet is where you are diarising every or most, if you can, meltdowns, breakdowns, whatever, writing down what happened, how did they react, what did they do, what was the situation, like what time of day it was, where was it, who was there, what happened immediately before the situation or the meltdown or what have you, and then how did it get resolved afterwards. So what we're doing here is really trying to pull apart what the triggers were, what the early warning signs were, and start to recognize, okay, as you say, was this a behavior, a chocolate, or they just wanted an ice cream or whatever? Or was this actually maybe potentially driven by anxiety or something like that? You might need help to work this out with a therapist, but becoming aware of this and starting to diarize these things it can be gold. So it can be really helpful for you.
Okay. What is the most important message you would give autistic parents about self-regulation, compassion, and breaking stress cycles within the family?
Yeah, I think recognizing how much power you have. Often, sometimes parents maybe get offended or struggle to recognize that maybe there's something that they could do to change or influence their child. And so when I said before, it can start with you, you have that opportunity to break patterns that may be going on and on and on in families, which happen in families all the time. Happens definitely in my family, and I'm working on breaking those patterns and stuff as well. So I hope that this can help you feel empowered to become aware that, hey, I can actually do something about this. I can actually break these patterns. I can start to diarize some of these things within myself, recognize my own triggers, start to model some of these behaviors that I want to see in my child. I can start to model them to them. And this is actually really hard work. And this, even as a clinical psychologist myself, I've been working on this for years since I've had my eldest daughter 4 years ago. So it takes, and with support of my own therapist as well. So this takes time. It's not easy, but also from what you said around compassion, being compassionate to yourself, giving yourself grace. Not being we can't be perfect, and as I said before, if we make mistakes, we are going to make mistakes, and we're not always right with our children. And that's an opportunity to, like I said, model apologizing or model saying sorry. And that's fine. But then also having compassion for the previous generations before us as well. And knowing that they did what they thought was the best in that situation at that time with the resources that they had. And even if they've done horrific things, which have definitely happened, they did that because in that moment, in that crazy moment in time, that's what they thought they had to do in that moment. And often these patterns and behaviors didn't start with them, but maybe many generations back. So now is an opportunity it takes work, but now is an opportunity to be empowered and maybe learn more about this or learn more about yourself and say, where can I break this pattern?
Okay, and one final question, like we like to ask every guest here on the Deep Dive podcast. If there's one bit of advice you would like to give in 30 seconds or less, what would that be?
Oh, I've been on a theme with awareness in this episode. I think there is so much opportunity for us to become more conscious of ourselves. We, on this nervous system kind of path that we're on that we've been talking about, we are often just running in fight or flight constantly all the time, and we don't have time or we don't take the opportunity to stop and actually just sit with our thoughts and our feelings. Can be very scary to do that. I'm being very real. It can be very scary to actually just sit and go, hang on, what am I thinking? Knowing that what we think is not actually always true. Maybe we're thinking we're not good enough, we don't look great, we don't speak well, I'm never going to get that job interview or whatever. But they are just stories that we're telling ourselves. They are just things that are in our head, and we don't have to listen to them. Becoming aware that those stories are happening, becoming aware that we might be in fight or flight constantly, writing down some of these things, getting them out of your mind. I think that's it can be really life-changing.
Okay, and Emma-Leigh Senyard, thank you very much for being part of the Deep Dive podcast today.
Thanks for having me, Michael.
Follow Emma-Leigh on her Instagram page at dr.emma-leigh.senyard or go to her website drsenyard.com.